Hi, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the host for the Dean's Chat podcast. I'm joined today by my co-host, Dr. Joanna Ritchie. Hi, Jo.
Hi.
Great to have you on again. And today, Dr. Ritchie and I have the opportunity to interview a leader in our profession who has truly done all things podiatric medicine. Welcome to Dean's Chat, Dr. Kieran Mahan.
Well, thanks very much. It's great to be with both of you.
Thank you so much for carving out time in your schedule. And, on Dean's Chat, we're pretty informal, Dr. Mahan. And if it's okay with you, let's go with first names, Kieran, Joe, and Jeff.
That's good with me.
Fantastic.
Kieran, it's been such a pleasure to get to know you over the last year or so. And as we've had our little opportunities for me to kind of connect and get to know you, I thought there's not many people that could share the kind of perspective and experience that you have. As Jeff said, all things podiatric medicine, how much you embrace and embody that concept. So I am humbled to do your introduction today. It's going to be brief because, again, your CV is remarkable, but Dr. Mahan completed his undergraduate degree from the University of Toronto in 1974. You got your master's degree from the University of Bridgeport in biology and went on to complete podiatric medical school at the Philadelphia College of Podiatric Medicine, and you graduated in 1980. You went on to complete a 3-year surgical residency program at Doctors Hospital in Tucker, Georgia, studying under John Rook, who we also had the privilege of talking with recently. And then after residency, you went back to work in Philadelphia for the Pennsylvania College of Podiatric Medicine and held many different roles and responsibilities, including the Residency Director, the Clinical Dean, Associate Dean for Research, Chairman of the Department of Surgery, and Dean of Academic Affairs multiple times. Were you always interested in academics?
I think I've always been a kind of intellectual person. And by that, I mean, I like to read. But I think it was my experience at Doctors Hospital that got me interested in that. And probably Don Green, who hopefully I'll give credit to all the people who, helped me along the way. And Don Green was, if Don Green hadn't taken an interest in me, I think my life would have turned out differently. I don't think I would have had all the opportunities I had. And it's kind of an interesting story. One day, when I was a third-year student, he asked me to give a presentation on a flatfoot patient to McGlamry, E. Dalton McGlamry. So
no pressure there.
Yeah, but I knew E. Dalton McGlamry was important. But of course, I was a third-year student. I didn't really know how important. So I gave my presentation, and Don Green liked it, and he told me he thought I should go to Doctors Hospital, and that's not the way I had envisioned myself. So it's really because of him that I went down there and spent a couple of weeks in John Ruck's office, and just saw these amazing things, and and so that was kind of the start of my academic career, was having that opportunity to go to doctors.
That's fantastic. How did you get interested in podiatry, or how did you find podiatry? What's your story?
That's kind of a funny story. I really didn't know what I wanted to do. I thought about healthcare, but I didn't really want to be on call all the time. And so at the University of Toronto, the Dean of Men, a guy named Rick Hayward, wonderful guy, who's got a son named Kieran. There's not a lot of Kierans out there in the world. Had a brother-in-law who was a podiatrist in Toledo, Ohio. Charlie Marlowe is his name. And he said, you should go visit my brother-in-law because he loves what he does. So I did, and I didn't know anything about podiatry, never been to a podiatrist. We didn't have one in the family. And, I saw his passion for it. He had a great office, a great relationship with his patients. And so that sparked my interest. And then I spent time with a couple of podiatrists in my hometown of Stamford, Connecticut, a guy named Bob Rinaldi, who's now, I think, a garlic farmer in Vermont in his retirement, and Mike Sabia, who took me, which was kind of them, they took me to Stony Brook for a seminar with Lowell Weil and Steve Smith. And, I appreciated that, those three people really helped spark my interest. So that's really what it was, those three people.
Yeah, that's great. And I know just from talking with you, some of your prior work and even your research experience, you're one of the few in our profession who has a lot of pediatric experience and exposure. What was your interest, or how did you get involved with that?
Yeah, I always had an interest in kids in general, but at Doctor's Hospital, we treated a lot of kids. And we're doing a lot of cleaning out in our house. I kept a thank you note from a patient's mother. We had a very sick kid. This had nothing to do with podiatry, but we were the residents who had to do the saphenous vein cut downs, and this kid was critically injured and had to be helicoptered to the Children's Hospital in Atlanta. And I was a first-year resident, and I remember that pressure. And there's, you're on your own, and but I've kept that little thank you note. But I just love the opportunity to make a difference in children's lives. And when I was at PCPM, we had Jim Ganley, who was teaching the pediatrics course, and he ran the pediatrics clinic. And so when I was a second-year student, we were not really supposed to be in clinic at the time. I would skip microbiology class. I would put a white coat on, and I would go follow Ganley around, Dr. Ganley. And I had a notebook, which I still have, and I would keep notes on his patients about what he was doing. And if I couldn't get down there next week, I would go to medical records and I would see what he did. Because he was, a wonderful human being, and he was a great teacher, and he had so much experience in pediatrics. And later on, when I came back to PCPM, he was being treated for an illness. He had me operate on one of his patients, the other side, an Evans osteotomy, which is, he's the one who brought that to the profession. And he had me do it at his hospital, and he told me, I won't be there. You just go ahead and do it. And, and then he came that day. And so he was kind of looking over my shoulder.
No pressure there.
Yeah, but it was such an honor to have him ask me to do, procedure that he had, so much to do with.
Yeah.
And he was really an inspiration for me in terms of, working with children.
That's spectacular. It's always neat, I feel, finding these little sub niches in a already specialty zone, but there's so many different opportunities. And pediatrics, I feel like, is, kind of really special. And maybe this is my own bias, but there's just not as many pediatric focused podiatrists. So I always find it really interesting to hear more about that particular niche, since it seems more rare, I think.
Yeah, and at Doctor's Hospital, Dr. McGlamry was getting referrals from all over the country, and so was John Ruck, and Stan Kalish was there, Louis Jimenez. I was fortunate to have all of them as teachers, and obviously John's been my teacher, but also my friend, really. Throughout my life. He was the first person besides my wife and I to see our firstborn child.
Oh,
he
wow.
came to, which was at a different hospital. He came to the hospital just to see our newborn. So Yeah, so that's been a special relationship.
Absolutely. And I think you had also mentioned to me that your daughter's also a podiatrist.
Yeah,
Speaking
so
of family.
my our daughter Caitlin, um, when we gave her that name, we thought we were being very original. But of course, when she started to play soccer with all the other kids, you yelled out Kate. Well, they were all Kate in one way or another. She had come with me to the college a few times to see patients, and she did in high school. She did a project with Howard Hillstrom, who was the director of our Gate Study Lab at the time. So I guess that's what got her interested. And she came to me, she was a junior at Notre Dame, and she came to me and said, Dad, I think I want to be a podiatrist. And I said, that's great. I said, do you think you want to ask me any questions? No, I've done the research. I already know.
Oh.
So, yeah, so it was great because she came to Temple, and I had the opportunity to teach her. It was a little awkward for me in classes. I don't know how it was for her, but in class and in the clinic, and I couldn't do evaluations of her, obviously, but to see patients together was really special.
Yeah, I could imagine.
Yeah, yeah, that was really great.
That's fantastic. How many kids do you have?
I have 5 kids.
Wow, that's spectacular.
And 5 grandchildren.
And I'm sure that keeps you very busy.
Yeah. Well, 3 of them are close by. 2 of them are in Pittsburgh, which is about 6 hours away. So.
Okay.
Kieran, I have a question for you. When you were at Doctors, teaching was so prevalent, right? Everybody was just passing information down. How did you decide to go back to Pennsylvania College and become a teacher to continue the teaching experience? Because not everybody does that.
So Don Green was leaving at that point to go to San Diego, where his brother was in practice. I think his dad too. So there was an opening, and I thought it would be an opportunity to continue what Don had done. And I loved Don Green as a teacher because he had a reason for everything he did. If he was using a 27 gauge needle instead of a 25 gauge needle, he had a reason for it. If he was using one local anesthetic versus another, he had a reason for it. And he was just a great teacher. So that was really the reason. I didn't really think I would stay there forever, or not exactly forever, but for all of my career. But it enabled me to do multiple things, to teach students, teach residents, have referral patients, get to do all kinds of things, in terms of surgery, interesting cases, trauma, all these different things, and a lot of administrative positions. So it kind of kept things always interesting.
I was reading your CV and I noticed the grants that you were getting, large grants, $300,000, $500,000, educational grants. That is very unique in our profession. Can you comment on, writing those proposals and getting the grants and how you use them?
Yeah, so I won't take full credit for that. One of the largest grant was an educational training grant for the schools of podiatric medicine at Temple, or PCPM was the lead school but was done in cooperation with the other schools. And it was really a great opportunity. The federal government funded that for faculty development activities for the faculty of the colleges. And the idea was for the colleges to work together to provide faculty development activities. So we had seminars where faculty from all the different colleges at the time, participated in that. So that was very rewarding because I think it helped motivate faculty.
That's interesting because now when you look at AACPM, there's the curriculum guide that came from all of the faculty getting together, whether they're basic science or clinical faculty. And maybe that experience was the impetus to start those kind of efforts.
Well, I think it was part of that. I think certainly the faculty council of the AACPM used to be very, very active. And I think that's a good thing for faculty to meet and kind of cross-pollinate from all the schools. Kind of tough to do, but I think that's an important activity because so many activities academically should be driven by the faculty, really.
Absolutely. Go ahead, Joe.
Kind of piggybacking on that, I know you were part of the merger process as well for the Philadelphia College becoming part of Temple. Can you talk a little bit about that experience and what that was like?
It was wild. So I was interim president for not a long period of time, but I had not been in the office long. And we got a call from the medical school dean at Temple saying he wanted to talk. And that had always been part of our strategic plan, was to be part of a larger institution. And we had talked with the other schools in Philadelphia. It's a large academic community, lots of medical schools, universities. But that seemed to be the best fit. But there's a lot of back and forth and negotiations, and it's a big university. It's 40,000 students, and I think 16 schools and colleges, and so integrating into their health system was part of that. At the time, they had a children's hospital, which was great for us for about, 10 years after the merger. So it was, would I have ever thought I would be involved with that? No. And, there were three of us who did the primary negotiating. Paul Quinnavalli, another podiatrist, was one of them. It was certainly challenging and interesting and rewarding to be part of that process. So, kind of a quantum leap for us to be part of this healthcare system with a level 1 trauma center and the Children's Hospital and all kinds of other things. So, I never imagined, of course, I thought of myself only as a surgeon teacher. That's the way I thought of myself. And so, but there were all these opportunities that came along in the profession to do these different things that were kind of, exciting and rewarding.
Absolutely. And I know in that spectrum of exciting and innovative, I mean, there's so many things that we could unpack from the different opportunities you've had in your career. Obviously, my first introduction to you was with the AO organization, and you had the chance to go to Davos, Switzerland in the 80s, and you studied under Stephen Perrin. Is that correct?
Well, so my first AO course was actually at the University of Vermont.
Okay.
So that was a general orthopedic course. And that's the way it was back then. There were no podiatry courses, so you took the general orthopedics course. So there were two other podiatrists, George Trachtenberg from Vestal, New York, who I'm still friends with to this day, and Bob Sprinkle from North Carolina, who's he and his son started a residency at Wake Forest. So Stephen Perrin was at that meeting, and Tom Rudy of Rudy Algauer was my tabletop instructor.
Oh man!
It's Howard Rosen, who was the first American orthopedist to really be involved with AO, was one of the faculty members. So I have a prop, and that is the program from
That's awesome.
my first course in 1982, and that includes my handwritten notes. And somewhere in my house, I actually have cassette recordings of some of those lectures. So it shows you what an impetus. And those courses were like a week-long course. And then later I took the advanced course in Davos, and I took was called the Master's Comprehensive course. It was a trauma course in Davos. Both of those were orthopedic courses. Okay. So, yeah. So that was really, and of course, I was being taught by people who had already been educated in the AO movement. Ruck and Montgomery and Kalish and Jimenez. And that turned out to be something, that I was involved with really throughout my professional life. And I think a big reason why I enjoyed it so much is that the AO is really, it's not about attracting attention to yourself. It's all about education.
Yeah.
And as you know from the newer faculty development courses they have for this, Joe, it's based on what the learner needs, not what you think they need, but what they actually need, and what are the good ways to deliver that material to them. So I always thought of that as the AO is just a very, I don't know what word to use, but it was kind of true to its spirit, and not a commercialized sort of entity. So
principles based.
It was principles based.
Yeah, I can definitely mirror that sentiment, and some of the reasons that I said yes when Graham approached me about being involved was the mission is about the education. The mission is about not teaching a thing or a device or a product. It's about the principles and understanding what we're doing, why we're doing it. I love that you mentioned with Don Green, the why. He would tell you the why on stuff. It's funny sometimes to sit back and think about the people in your life that had the most impact in terms of either how you think or how you do certain things. And certainly for me, I've noticed anytime I can associate a why or even an underlying understanding of something, it's always linked to people, right? The people that taught me these things. So I think it's neat that you commented on some of those for you. And you were the co-chair for more than 20 years for some of these educational opportunities. How is it that you got involved with those initial AO courses?
Yeah, so, the Podiatry Institute out of Atlanta, which was McGlamry. It was McGlamry. McGlamry, that was in his basement. We're making slides in his basement. That's how it started. So the Institute was teaching courses, and certainly John Ruck was the primary one who I think was driven. And we had the opportunity, we were invited to meet with AO, John and I and Chuck Gudis, and Jack Schuberth was involved right after that. So I think that collaboration, working together on these things, it's fun. They're great people. So the opportunity to collaborate, and the faculty at those AO meetings, were so outstanding. So, it was very rewarding professionally to be associated really with that. So yeah, I give John really the credit for keeping that alive at a few different points when maybe it wouldn't have been, but he was the zealot, and I mean that in the missionary sort of way, in the good way of being devoted to that AO spirit.
Yeah.
So it was a wonderful opportunity to be involved with the AO. Yeah.
That's fantastic. To piggyback off that, then, all of the different academic opportunities that you've been involved in, you won Outstanding Professor of the Year multiple times. What is your teaching style? What is your kind of philosophy or take? Or what are your?
I don't know. It's probably a lot different now than it was when I started out, and I would have been more of a tough guy. And whereas this year, when I taught a lot of the course, the Rarefoot course, one of the student evaluations was the grandpa we all wished we had. So I think I've become a little bit more of a gentle spirit in trying to teach. And I think I learned I had to change as students changed, and that doesn't mean there's anything wrong with them, because they're like this class I just taught, they're wonderful. Man, I had to adapt. So I've tried to inspire where I could, try to give people advice to seek the most training that they could, have aspirations professionally.
Yeah. I think that's again, it's another kind of testament or mark for you in terms of being willing to look at the way you do things and adapt and be flexible and change for the better. It's been interesting. I've been teaching for 12 years or so, and even over the 12 years, my teaching style has changed, and it's partly, I think, as you do it more, you start to realize what is effective and what's not effective. But then, to your point, our learners change, and what they need from us changes, and the ways that they find information recently has changed and shifted. And so again, it's such a fun thing to be a part of. But sometimes flexibility and adaptability and change is hard, right? Like, why can't we just do it the way we've always done it? And that was something I also really appreciated in those faculty education courses with AO, is really kind of looking at the heart of how do we learn, what is effective, what do we know is too much or not effective, and then how do you figure out how to make that work? And again, I appreciated doing those with you. It's fun to get multiple perspectives and experiences.
Well, I think the big thing is ultimately it's not about us.
Yeah,
it's about them. It's not about us. And I won't say I necessarily totally understood that, in the beginning. I think that, so I think I did have to adapt. Just as I'll tell you, when I finished at the Podiatry Institute, and we always ran these seminars all across the country, the audiences were people who did not have much training, and so what they got at these institute meetings was a big part of their education. And now, of course, that's changed. And we used to see that in the AO courses where residents would bring cases from their hospitals. And, you gradually saw how much more trauma was being done and how much more sophisticated work was being done. And when I did my residency, it was one of 2 3-year programs, and people thought I was crazy for doing it. I mean, literally,
Yeah.
I wasn't sure. I had planned to go back to Connecticut where I grew up, and Connecticut didn't have a law at the time that would support that. Um, so, now you look at the profession where everything's a 3-year residency and the quality of the residencies has improved so much. So, that's that's great to see at this point.
Yeah, I was going to say it's got to be tremendously gratifying if you were to look at a family tree, so to speak, of the Podiatry Institute and Doctors Hospital to see the impact you've had on doctors that have gone on to train the next generation. So it's incredible.
And that's, that was really driven by McGlamry. And, he never asked anybody to do anything he wasn't already doing twice as much. So, he, in a sense, to live up to that standard, there was a lot you had to do. So he has had a incredible impact on this profession through that training program, and also the textbook. Before that textbook came along, there really was not a definitive textbook in pediatric medicine and surgery. And when I was a 3rd-year resident, John Ruck, myself, and Dr. McGlamry, I still call him Dr. McGlamry, not Dalton, sat down in his living room and outlined what those chapters. I was a 3rd-year resident, outlined what those chapters would be, and that was the first 3-volume edition, and I think that helped people to understand what the scope of the profession really was. And I think that was a tremendous resource really for the profession. So, and that was gratifying to be part of that textbook.
That textbook was literally the foundation that we all used. The 3-volume set, I'll never forget. Carrying it around everywhere.
Yeah. Oh yeah, and writing it on I don't know, these floppy disks at the time, and I wrote a number of chapters for that first one, and then I gradually I wrote less. The last edition I wrote a chapter with my daughter, so that was fun, and we did another chapter for another textbook of pediatric surgery with Michelle Butterworth and J.T. Marcoux. So, but yeah, that textbook, couldn't have happened without McGlamry. So,
wow. With all this educational background, it was only fitting that you got involved with the CPME, Council on Podiatric Medical Education. Can you comment on your experience there? Because I know a lot of us had the opportunity to work with you, and it had to be tremendously gratifying to work with all the colleges of podiatric medicine.
Yeah, being part of CPME was really a great experience for me. It's partly the people that you're associated with who are involved with it. And it's not just the other podiatrists, it's the people who are public members bring a tremendous amount, and they have a tremendous perspective on the profession. And so, I was initially involved with the accreditation committee, and that's what my primary committee was until I became chair. And then when you're chair, of course, you're part of everything. And you really have a sense then of how much is involved with, the approval of all the residency programs, all the continuing education providers, now the board certification providers, the colleges, and probably sometimes people don't necessarily appreciate that the council's role is to help people improve. It's not, the accreditation process in general is to help institutions improve rather than hold a hammer over their head. The idea is participation so that you can improve your institution. So I was chair during the pandemic. I don't think there's any link, but I'm not totally sure. So that had its own challenges, of course, at all the colleges and all the residency programs. It's challenging, but the staff at CPME is great. So that was just a tremendous experience. I'm still doing a few things with CPME, but I think it's a very important organization and very rewarding. So. Yeah, it was fun.
Well, they do an incredible job, and you're right. They're there to help us be better. Oftentimes I think CPME is associated with punitive, issues, of course, but they are there to make you better, and I think we're all better for that. Just a little plug for CPME. I mentioned this earlier, Kieran. I was so grateful when you and Mike Treppel helped me take the Arizona School of Podiatric Medicine and helped it become the Arizona College of Podiatric Medicine. And I think that's just a testimony to the collaborative effort that we all have to advance the profession as a whole. So I was always appreciative of that. Thank you.
Well, I think that's what it's all about, is not our individual schools. It's about the profession. And we all want the profession to be better for that next generation. And you can't do that standing still. So
I agree completely. So, Joe, you mind if I shift gears? I was going to ask a couple other questions. So, yeah. Kieran, with your history in the profession and all the things you do, again, it makes me wonder if you ever slept, but you had to have some interest outside of podiatric medicine. What do you like to do to recharge the battery?
Well, it's easier now that I'm retired. I'll say that. But so I'm learning Irish. I love all things Irish, which is something I got from my father. My father's parents came from Ireland, and on my mother's side, they all came from Ireland at some point. And we took the kids there. That was a life goal, to take the kids there. So we did that, I think, in 99.
Oh, that's awesome.
So the next life goal is to take the kids with the grandkids. So we hope to do that in a year or 2 years. And I like reading. I just read a book. I kind of wish I'd read it a while ago, but it's called Strength to Strength by Albert Brooks. And it's kind of about designing the second half of your life. Not necessarily retirement, but shifting gears at some point in your life. So I like to read. We have a house up in Connecticut, which is meant to be a grandkid magnet. And, we're involved with our church. And I've had the opportunity to walk and lose weight and get more healthy after I retired and don't have the commute anymore. But so yeah,
I thought maybe that was from chasing the grandkids.
Yeah, well, it's that too. They're 4, then 2 5-year-olds, a 6-year-old, and then a 10-year-old. So they're all pretty close together. So it's good. They enjoy being together. So that's rewarding.
At some meeting, I'll have to introduce you to my wife, Kieran. Her maiden name's Moynihan, and they're from Cork County, Ireland. And we went there and traveled around and got a feel of that Irish life. And I could see living there. Yeah.
I used to think about that, but not with grandkids here. There's no. In fact, I'm actually an Irish citizen because my grandparents were born there. So I was able to get Irish citizenship in two kids who were born after I got that citizenship could also get it as well. So that's like a more of a sentimental thing. You can get an EU passport, but that's sentimental rather than practical. Yeah, I'm not planning on living there, but we still have cousins there. So
That's great.
What was your favorite part when you got to go visit?
So we've been there a few times. I think the hard part about visiting Ireland is, though, even though it's a small country, it's there's not a straight line between 2 points necessarily. Certainly, the Southwest, Kerry and Dingle coasts are very, very beautiful, and my wife and I went to the Blasket Islands off of that coast, where that was the kind of the last place where only the Irish language was spoken. It's still spoken in lots of other places now, but not exclusively. And it was evacuated in 1953, but just the stories, and I had read a book about it, the stories about the culture there and how they preserved their stories orally, and music, their music. And so going places to hear Irish music, and that's, I love hearing Irish music. We drove to Rhode Island, which is about a 6-hour drive, just to hear an Irish band that wasn't going to come close to us, a band called Lunasa, which is an Irish word. And you have the opportunity to enjoy those things. And so, next Friday we're going to someplace in Philadelphia to hear a band, a musician who actually performed at one of our son's weddings, she and another Irish musician.
Oh, that's neat.
So those things, Irish, are part of what I enjoy.
Kieran, Ireland is the only place I've been in the world where I couldn't drive the speed limit. It's at 100 kilometers per hour, and there's these narrow roads with curves, and I was lucky if I got to 80.
Yeah, and you're driving on the wrong side of the road from the wrong side of the car, and I didn't care for that part, but there's lots of great places in Ireland. Galway's great, and the Aran Islands are great. Lots of famous Irish authors, land of saints and scholars. So,
well, that's great. I have a question for you, Kieran. You've had a lot of perspective over the years of our profession. Where do you see our profession going over the next 10 or 20 years?
Yeah. I guess part of it is the question of where fellowships will go, in a sense. I'm not sure they've really found their right niche yet. I mean, I'm certainly somebody who's always in favor of additional training, but I think it has to be targeted. So, for example, if we're going to have people doing a lot of pediatric surgery, we need to have pediatric fellowships. That's something we need to have. So I think there are areas that the profession could benefit from fellowship training to help the scope of the profession expand. And our biggest issue is trying to help college students who haven't been exposed to podiatry to understand what it is. Because, I was not exposed to podiatry. It was a fortunate encounter with one person who directed me, who was not a podiatrist, directed me to the field. And, it's been a blessing in so many ways to come in contact with so many great people and have great opportunities. And, the reward of taking care of patients, and of course, most of our patients get better. That's a very rewarding thing, and that relationship with patients is just, it just keeps you going. So certainly, I think that's why I see it as continuing to be a great profession.
Well, it certainly is a challenge getting the best and the brightest to come into podiatric medicine, because if they don't know about podiatry, out of sight, out of mind.
Yeah. I really do think that's the biggest issue, because even with dentistry, every kid goes to the dentist from, I don't know what age, but they're going to the dentist all the time. They're going to their pediatrician all the time. So they're exposed to those fields, and they're often not going to a podiatrist. So, certainly we have a lot of students who encounter an injury in college, and maybe that's their first exposure. So I think that's the biggest thing is finding ways to help people see what a great opportunity it is.
I always think it's interesting because you're a classic example. So many podiatrists of our generation, their kids become podiatrists, and no parent is going to suggest that their child go into a profession unless it's going to be a good move for them going forward. So,
yeah, I mean, absolutely. I think I think back, and I was not one to push my daughter or the other kids into anything. I wanted them to choose what they wanted. So really, she came to that decision just from kind of watching me and seeing what I liked about it. And so, she did. She ended up doing the 4-year residency at Presbyterian with Mike Downey and Scott Millay, who were also Podiatry Institute people taught by McGlamory and Rock and Kalish and Jimenez. So, and she's relatively nearby, and we can talk about cases and, so that's very rewarding for me to, and, for us to write together.
I can
better
imagine.
writer than I am. So that's been a big help.
Oh, that's great. I'm sorry, Joe, I keep asking all the questions here.
No, you're good. I front loaded mine, so you're good.
Okay. So I wanted to go back to fellowship training, if you don't mind, Kieran. So having been involved with CPME, we've got fellowships, and they're approved by the American College of Foot and Ankle Surgeons. Some of them are approved by CPME. There's a couple that are approved, if you will. I don't know if approved is the right term, but there's some that are acknowledged by both. Is that an issue that we have going forward with fellowships? Your thoughts on that?
Yeah, so my personal opinion, not, I'm not on CPME anymore. My personal opinion is that they should be approved by CPME. We do the residencies in conjunction with the boards, for example, and there's certainly ways to do fellowships that are done in conjunction with, let's say, specialty societies or boards where they're part of that process. But I think the issue is when the fellowships are based out of a private practice, it's harder to attest to the quality, and there may be very quality experiences. I'm not certainly denigrating them. But you have to be able to do that, and doing it through an institution helps assure that quality in a better way. And I think that's, currently one of the requirements of CPME. So if I had my choice, that's what I think would be a better thing. And I would think we ought to be able to come up with some solution for that. That's kind of what I think.
That makes sense. I mean, just being in an academic institution, having curriculum and meeting milestones and depending upon the specialty within the fellowship, of course. But I agree with you. And I think there's room for both, approval by both.
Yeah.
Joe, what do you think?
Yeah, and I think it's important to think of it in this larger context as well, that, if we don't try to standardize it in some way, you don't really know what the product is when you come out, right? So as residents are looking at these fellowships and they're trying to decide, where do I want to go? What do I want to do? Having a niche like, this one focuses on trauma. This one focuses on pediatrics, which I agree. We need to figure this out for sure. This one focuses on ankle replacement, right? That is something. It gives them a little bit of direction in terms of where to go, but then they don't, if there isn't some kind of standardization or accreditation process, they don't actually know what they're getting from that outside of word of mouth, which, again, to your point, it doesn't mean there's anything wrong with it. It just means it's a question mark, right? And so much to the conversation we had kind of maybe back in the beginning, talking about the accreditation of schools. And, sometimes it feels like the big brother coming in and like, telling you all the things you have to do. There's value in that. And even though it can be tedious and exhaustive and sometimes feel very labor intensive, the value is the students know what they're getting, or when they leave, we all know what they got. Like, there is a standardization, and there's a lot of value to that. And especially as we move into this world of parity, and we need to be able to answer for what we are certifying these fellows in terms of what they're capable of doing, what kind of roles maybe they are more qualified than maybe somebody that didn't do a fellowship, or, the question mark, are they more qualified? Like, these are important questions, and they're not easy to answer. And so having some kind of standardization helps that process.
Yeah, I think you're right. Of course, I've been on the other side of approval. I mean, as a residency director and as a dean at a college. And so nobody or everybody's nervous and everybody has anxiety when you're part of that process. But it is part of a process to make things better and to ensure some quality. And, the people on the residency review committee of the council spend a tremendous amount of time reviewing these programs, and the people who go on site. And I used to do site visits to residency programs. The other thing is, it's a good way to say, you're doing a great job in this, and this. And you often, that's what you say. And that helps programs and colleges when they get that kind of feedback as well. So in terms of fellowships, yeah, I think it's important to have expectations and standards, and exactly how to best to do that. I think probably should involve some kind of more uniform approval process. I'll put it that way.
I agree with you. Here's a lighthearted comment for you. I noticed that there's a direct correlation between deans retiring and an upcoming CPME visit. I don't have statistical proof of that, Kieran, but I've seen it, all right. Kieran, it's just been such a wonderful interview. Thank you so much for joining us. Joe, do you have anything else?
Out of all of the projects that you've been a part of, what would you say? You don't have to, maybe I was going to say what's your favorite, but that might be a little too what are your top three, would you say?
If you say projects as opposed to, students, residents, certainly AO and the textbook are two, and CPME, I'd say that those are the top three. But there's a lot of other things that I've had the chance to be involved with, internationally, and things that are, it's just been, it's going to sound morbid, but my wife and I were talking about somebody who's ill, that a friend of hers, And I said, if I died, I would want my family to know that I've had a great run. I mean, I've had such a great time doing this profession and having this family. So the profession's been, just enabled me to do great things with great people.
Yeah.
I'll leave it at that.
Wow. Well, on behalf of the entire profession, Kieran, thank you for all you've done in all the different roles and different hats you've worn. Appreciate you carving out time in your busy retirement life to join us, of course. And to all of our listeners out there, if you're listening on Spotify or Apple Podcasts, please give us a 5-star rating. And of course, if you're watching on YouTube, please become a subscriber. Kieran, I'm going to send you one of these Dean's Chat cups for your morning beverages. And Joe, thanks as always. Any last words, Dr.
Yes.
Mahan?
I will say, Gorav Ma Agat August Slan. That means thank you and goodbye.
Oh my gosh, that's fabulous. Thank you. Cheers, everybody.